Medical experts say Merkel cell carcinoma is a rare but highly aggressive skin cancer and the second cause of skin cancer death after melanoma. It's usually a fast-growing nodule or tumor on your skin. It might be skin-colored or it might be blue, purple, or reddish in color. It can develop anywhere, even on areas not exposed to sunlight. Merkel is like other skin cancers. It's the abnormal growth of skin cells. So what are some common risk factors?
Known risk factors for skin cancer include things like a lighter natural skin color, skin that easily burns, having paler eyes, pale hair, having a family history or a personal history of skin cancer, and then of course older age.
And the most important thing to keep in mind is if you notice any changes in your skin, see a healthcare provider.
We don't have any specific recommendations about skin cancer screening in a medical setting, but we do recommend that people watch themselves and their skin for anything that may have changed recently. So a mark that has grown in size, has changed color, has become irritated, anything like that should definitely be seen either by a healthcare provider or even a dermatologist if possible.
And here's the scary part. The National Institutes of Health says only 1 in 6 men and only 1 in 7 women get their skin checked once a year. The 5-year survival rate for Merkel cell carcinoma remains around 65%, underlying the unmet need for unique treatments.
ADPH reveals the rate of cervical cancer in Alabama is far higher than the national average. And a simple way to prevent it is with HPV vaccinations. Early detection is key too. Our Jasmine Bird is live in the studio. And Jasmine, what more have you learned?
Yes, Kanisha. So each year in the United States, about 13,000 new cases of cervical cancer are diagnosed and about 4,000 women die of this cancer. But we can help change that. Alabama Department of Public Health Director of Cancer Prevention and Control Division, Nancy Wright, says cervical cancer can happen to any female at any age.
Generally, the older you get, the more susceptible.
Age, being a female and being African American, puts you at higher risk for getting cervical cancer.
Cervical cancer is caused by what we call the HPV virus, the human papilloma virus. That is a virus that almost every woman gets.
Most are able to fight off that virus and recover from it.
A small percentage of women, I think it's 5% of women, are not able to defeat that HPV virus.
And so over time, that virus can cause cervical cancer. And that's why the HPV vaccination is extremely important.
Because that vaccination will stop the HPV virus from being able to live long enough to cause cervical cancer.
And that's for a lifetime. Wright says we can definitely do something to stop this.
So that your mom doesn't die from cervical cancer, or your daughter, or your sister, or your aunt. This is it's like the only cancer, that we're able to stop or prevent, and it's so easy to do it.
And children are also strongly encouraged to take this vaccination.
We are encouraging children, students, to take it when they get their Tdap vaccination at school.
Before they are ever exposed to the HPV virus.
Risk the chance of it not resolving and turning into cervical cancer.
That extended periods of sun exposure can increase the risk of skin cancer. Well, this Wellness Wednesday, our Jasmine Bird breaks down how to reduce that risk.
Anytime it's a day like today and we're exposed to direct sunlight, we get something called UV light. And UV light is a part of the sun's radiation that can be very concerning for our skin.
So if you're outside from 10 to 4, exposed to the sun without sun protection, then you're absorbing those UV rays, which can lead to skin damage and then to skin cancer.
Dr. Wes Stubblefield with ADPH says an interesting thing to note is that sunny days aren't the only time you get UV exposure.
It has to do with the angle of the sun. UV radiation is not zero at any time, and it's still present even when it's cloudy.
Swim teacher Samantha Norton agrees.
And even on days like today when it's not super sunny, always put on sunscreen because you can get sunburned even when it's cloudy. I always make sure I put it on before I get in the water, and then when I get out of the water, I dry off and I put it on again.
Norton uses sunscreen as her ultimate P&P protection and prevention.
Just to make sure that I have a shield from the sun so that I can prevent myself from getting burned or having a risk of some type of skin cancer later on in life.
Dr. Stubblefield also adds that people who have lighter color skin are at a higher risk of skin cancer.
People who have lighter color skin, hair or eyes, some people who take certain medications can be at higher risks, and then people that have a family history of skin cancer. And that can go back to that inherited part.
But the most important thing to remember is
people with darker skin, although they have more melanin in their skin, they're not immune to the risks of sun exposure and skin cancer. And we do recommend that everyone take precautions against sun exposure, regardless of the color or the shade of their skin.
Early detection is key for any cancer, but today we're looking at breast cancer. The CDC reports that breast cancer is the second most common one among American women. This Wellness Wednesday, our Jasmine Bird tells us some best practices.
most breast cancers are found one of two ways.
Either a palpable lump, or lump that you can feel, or on a mammogram.
And one of the factors that could cause some women to be more susceptible.
We know that women in high stress situations, whether it be high stress jobs or family situations, we see a higher incidence of disease, including cancer in those women. So knowing and being aware of your emotional health is very important too.
Breast cancer is the most common cancer in women overall and in the U.S.
The second leading cause of cancer death in women. There will be in 2023 that the projection is that 4,500 Alabama women will be diagnosed and 720 will die of breast cancer. So this is a serious problem, and again, screening can be helpful in getting to early treatment and possibly to cures.
And early detection is key.
Now we're finding breast cancer stage 1, stage 0. So we have the ability to find breast cancer early, but it is all about getting those screenings done, again, those breast exams, being able to find those lumps and identifying patients that have a lump and then getting them the appropriate care.
And another thing to note is that Black women have higher mortality rates for breast cancer.
White women have slightly lower risk than the rest of the U.S., and Black women are about the same.
Also, when discussing the right age for screening, that usually falls under the category of general population. So in other words,
that's every woman in the United States that we're focused on getting that first mammogram, what we call the baseline, meaning a woman coming in with no problems, no symptoms of breast cancer between age 35 and 40, and then annually every year beginning at age 40 for all women.
In Huntsville, Jasmine Bird, Fox 54 News.